All right, everyone, we're going to go ahead and get started here. So I would like to welcome you to the April 2020 edition of the North Central Region Aging Network webinar series. I'm Kristen Litzelman. I am a state specialist with the University of Wisconsin. And today what I'd like to tell you about is some information that we gathered from family caregivers across the state of Wisconsin about their experiences with systems navigation. The quote that you see in the title there, the most rewarding and difficult job, that comes from one of the open-ended responses that the caregivers gave us, expressing their experience with systems navigation, both the difficulties, but also sharing that they feel it is rewarding despite all of the challenges that they face. And so, we are just going to walk through some basic information about the background, just making sure that we're all on the same page with who family caregivers are, who we're talking about here. And then I'm going to detail some of the results that we found and end with a little piece of information on what I see as the implications from this. I welcome questions. I will let you know that I can't see the chat box while I'm sharing my screen like this, but please, if you do have questions, feel free to jot them in the chat box and I will get to them at the end. And if you are on the call and want to ask a question verbally, it's okay for you to unmute yourself and go ahead and ask, and we can have conversations that way as well. So the first piece that I want to do is just set the scene here. When I'm talking about family caregivers, I'm really talking about people who are providing some kind of care to a family member or a friend with an illness or a disability. And so I'm casting a very wide net here. I am talking about people who are caring for children with intellectual or developmental disabilities, with older adults who have chronic conditions, middle-aged adults who need some sort of care due to an illness or a disability. It's really wide-ranging. And when we look at this in total, there are around 40 million US adults that are family caregivers in this way. What we know about caregivers is that they have a lot of unmet needs. Caregivers are at risk of elevated levels of burden, of stress. They're at risk of problems with depression and anxiety. They're even at risk of physical health problems. And so I want to contextualize this around the fact that caregivers also feel that they get a lot of good things from their caregiving. Many caregivers identify that they feel they've grown from the role, that they have a sense of purpose in life related to the role. But that doesn't change the fact that they also experience these burdens and stress and have unmet needs. And what's interesting about that is even though caregivers have these unmet needs, and the fact that we have lots of resources available for them, many don't use the available resources. Only around 28% use financial resources, 23% use transportation resources, and only 15% use respite care in a national survey. And so that is something that is curious. Why are these caregivers who have needs and even say that they have needs and would like to access these services, why are they not making use of these services? So enter the Wisconsin Family and Caregiver Support Alliance. This is a sort of coalition at the state level in Wisconsin whose mission is to raise awareness of family caregiver and support needs, increase the availability of and access to services and supports, and keep people across the lifespan engaged in their communities in the way that meets their goals. And they put together several work groups to address these aims. One of them was a systems navigation work group with the core goal of improving systems navigation and access. And I am a member of that work group. So when we're thinking about improving systems navigation and access, the charge of this work group was really to understand systems navigation in order to improve systems navigation. And there were several ways that we wanted to tackle this. The first was to collect feedback from a diverse group of families, caregivers, and professionals to identify gaps in resources and service provision, and to use that information to improve access and navigation. And so this is part of those different efforts that we made. So there were 3 strategies that we used to make this happen. The first was to take a look at professionals, agencies, and service providers across the state who provide these support services and provide these resources to family caregivers to understand what they see as the opportunities and gaps that caregivers experience and understand their systems navigation challenges through the eyes of the people who are filling those needs. The second was to gather even more information by going directly to family caregivers to understand what they see as the challenges with support seeking and systems navigation. And then the last one was to compare and contrast and really understand, do professionals and family caregivers see these things the same way, or are there contradictions in the way that they're seeing these systems challenges that might help us understand where there are opportunities to improve outcomes? And so today, I'll be telling you about the second piece here and the third piece, the way that that family caregivers see this themselves, and then I'll provide just a very brief overview of how we surveyed the professionals and share some information about that compare and contrast. So the approach was to do a needs assessment survey throughout the state of Wisconsin. This was conducted in summer 2019. This was not meant to be research. This was just a needs assessment to try to understand what's happening in those communities and how we can try to fix it. We collected information directly from these family caregivers with questions focused on the challenges and difficulties with accessing services. And we had some deep dives into things like the impact on employment, as well as a deep dive into respite care and why caregivers do or do not use respite care. All in all, sending this out through emails, through newsletters, through word of mouth, through partners, we ended up with over 600 respondents, which was fantastic. We were really pleased with that. When we looked at this for the current report that I'm going to be summarizing for you, we limited the sample to informal caregivers. I have that in air quotes because I don't believe that caregivers are ever informal, but that's to differentiate them from someone who is providing care in a more formal or paid way, such as an in-home health provider. So these informal caregivers were specifically family members or friends who were providing this care outside of the formal care setting. And we classified our respondents by the primary care recipient's age. So of course, many people were providing care to more than one person, but we asked them to identify a primary person. And we classified together caregivers for children and young adults who were less than 30. And then as a separate group, looked at the caregivers of adults 30 years of age and older. And the reason for doing that is because we anticipated that the needs and the challenges experienced by people who are caring for children or people who are sort of just past that childhood age are going to look different than people who are caring for adults and older adults. All in all, we had around 40% of our respondents fall into that younger category, and around 60% fall into that older category. And of the people in the older category, 3 out of 4 were caring for someone who was 60 years of age or older. So most of them are caring for older adults in that group. And then we assessed the descriptive statistics by group to try to understand what the most frequently endorsed issues were for family caregivers around systems navigation. So let's just talk about what we found here. Let's walk through this piece by piece. First, let's talk about the demographics. Who took the survey? Most of the survey respondents were white, non-Hispanic women. Around 91% were female, and around 89% were white, non-Hispanic. That racial demographic is not terribly different from what we see in Wisconsin across the board. But of course, when we look at family caregivers, we know that 91%, even though we see more women than men acting as caregivers, it's usually closer to like 65% women. And so this 91%, it shows that we don't really have a terribly representative sample here. It's heavily weighted towards female caregivers. So just that's something to keep in mind as we assess the results. Individuals who took the survey were caring for their son or daughter. This is not necessarily a son or daughter who is still a child, still a minor. This might be an adult son or daughter, but they still fall into this caregiving category. So 41%. They were caring for a parent or an in-law just under 30% of the time, and they were caring for a spouse or partner 16% of the time. And they were caring for individuals with intellectual or developmental disability, that's what IDD stands for, with physical disabilities, and with Alzheimer's dementia, and of course, a wide range of other conditions. These were just the top 3 that I wanted to note here. And what I think is particularly interesting and sometimes goes overlooked is that the caregivers themselves, caregiving spans the life course. It doesn't just happen in one particular age range. It really, family caregivers are of all different ages. And so when we look at this by group, we see that for those caring for a child or a young adult, we had most of the sample falling in the middle age to older age, or really the middle age categories, so 30 to 59 or so, with a little bit in the older age group and a little bit in the younger age group. When we look at those caring for an adult or an older adult, we see that we're really weighted more towards the middle age and older end of the spectrum. But regardless, for both groups, we see caregivers at all ages, from 18 years old all the way up to the oldest old of the age spectrum. And I should note that we only surveyed adults here. There are children and teenagers who play caregiving roles. They don't often get surveyed, and we didn't capture that information here. We were only looking at adults who were reporting on their caregiving behavior. So the very first question that we asked was about the difficulties that family caregivers experience. And so we'll walk through this. And again, I want to point out that this is separated by the age of the care recipient. So the red bars that you see are for the people caring for children or young adults. The orange bars are for people caring for an adult 30 years of age or older. So the very top 3 categories that came up when we asked caregivers to endorse the difficulties that they experience all relate to self-care. The first one was meeting their own personal needs, social needs, exercise, getting enough sleep. Most caregivers, regardless of who they were caring for, reported that they had challenges with this. 81% of people caring for children and young adults, and 70% of people caring for an older adult. That's a lot of people struggling to meet their own personal needs. Right underneath that was balancing the needs of other children or family members and balancing caregiving and work. So this idea of having trouble meeting personal care needs and having trouble balancing those different roles, those role strain issues, were very, very prevalent in the sample and the most highly endorsed difficulties that caregivers faced. The next 3 also hang together and tell us something important. Understanding governmental programs, this is things like SSI or Medicaid or Medicare, finding reliable home care providers, and having enough money to pay for care. These are all systems issues. And the one that I think is interesting here is both the struggling to understand programs, because we know that that's complicated and it is hard to understand, but also having enough money to pay for care. Because even when there are grants or supports that are provided and funded by the community, often individuals still need to pay a portion of those costs. And for some families, even that portion is more than they can handle. And so they really struggle with finding care in that space. And then the last few that I'm highlighting here are issues with handling dangerous or difficult behaviors, and really interestingly, getting cooperation from other family members. And so this is something that will come up again as we talk about these survey questions, but we heard time and time again from caregivers that they wanted to reach out for resources, but they couldn't get other caregivers or their family members to agree to that. Sometimes they couldn't get the care recipient to agree to that. And so that shows that not only are there issues with balance, issues with the systems themselves, but also issues within the family system of getting everyone on the same page for the caregivers to get the help that they need in order to succeed in their role. We also asked caregivers about service use. And so we know that for the people who responded to the survey, 63% of those who were caring for a child or young adult said that in the past year they had applied for services. 86% had received services in the last year. So you'll see that those don't really flow from one to the other, because people may have applied for services in previous years that they are now receiving. 77% contacted an agency for some reason. 64% said that they were comfortable knowing what to ask when they called, and 62%, under 2/3, said that they used suggested services. We see analogous answers in the caregivers of older adults, although what we do see is fewer caregivers of older adults reporting that they received services and more saying that they felt comfortable knowing what to ask. And then also fewer saying that they use suggested services. So only 45% of those caregivers, less than half, said that they had used the suggested services. So that leads to a really interesting follow-up question. For people who didn't use services, why? Why didn't they use the services that were available? Well, the very top-rated answer was that it was unavailable. A service was suggested, and it turns out that in their community, they just couldn't get access to that. That highlights a really key systems issue. The next set sort of flow together here. When they tried to get more information, their phone calls led to dead ends or runarounds. They didn't understand what the next steps were to access the resources, or they were just flat out too overwhelmed to start. So this highlights a communication issue, right? This highlights where the system is breaking down at the point where people get information from that system. And so that highlights some places that we have opportunities to help caregivers with this navigation piece. The next three also hang together. There was a waiting list, it didn't meet my needs, or I wasn't eligible or I didn't qualify. So again, these are systems issues where people are getting access to these services, they think, and then even if they are able to get more information, either they have to wait and so they can't get access to it. It turns out that the service that they thought they needed actually doesn't meet their needs and so they don't use it. Or there's a service available and they just aren't eligible for it, or they don't qualify even though it's something that they need and would like to use. And then finally, issues with affordability and with that time frame. It takes too long. The wait list was too long and it took too long to get assistance. It takes too long to apply, that barrier of actually sitting down and filling out the paperwork. And then the affordability piece that came up previously. So then we asked specifically about challenges with finding help and what their experiences were with that. The first response here, the most commonly endorsed response, was that there were no workers available. They wanted to have someone come and help them, and there just wasn't anyone who was able to come and help them with what they needed. Also, confusion around what they need. Sometimes we don't know what we don't know. And so if we don't know what's available, or we're so overwhelmed with the work that we have that we can't sit down and parse out what help we need, it's really hard to get over that barrier of asking for help and getting help. There aren't organizations that offer the things that they need. I imagine that this is particularly common in rural areas where there's just less density of services and supports in general. But someone may need help. They may know that they need that help. They may want that help, and there simply may not be that help available in their region. And then several others. The website's not helpful. I don't know where to get information. Contacts are unhelpful. The written information is not understandable. Phone contacts can't or don't answer my questions. This is a serious system issue. This is an issue with communication. It's too confusing to parse this information, and caregivers end up not knowing what the answers are or not feeling like they can get these answers. This is something that came up in the open-ended questions that we asked as well, highlighting the fact that caregivers feel like they can't get straight answers. They call and they get one answer from one person, and then the next time they call, they get a different answer. Or they try to contact an agency and they're told to contact a different agency who directs them back to the first agency. And it's just an experience that's incredibly frustrating for these families. I imagine that it's also frustrating for the care providers. But this highlights a really big opportunity where we can try to make things clearer and more understandable and more straightforward for these caregivers. As I mentioned, we did a deep dive into respite care because this is a key issue that the group is interested in. And so what we found, just in the prevalence of using respite care, is that most caregivers of older adults and adults and older adults have used respite care. We had 75%. I'm sorry, I'm reading my numbers wrong. We didn't have most. Let me back that up a second. When we look at respite care use, when people are caring for a child or a young adult, most are getting some form of respite care, 56%. But when we look at people who are caring for an adult or an older adult, that number is much lower. It's only 22% say that they're getting respite care. There were lots of reasons for not using respite care. First was the most prevalent, especially among those caring for an adult or an older adult, was that their loved one wouldn't want anyone else to provide that care. Now, of course, we didn't survey the care recipients, so we don't know if the care recipients agree with that assessment, but that's how the caregivers feel about it. They don't think their loved one would want anyone else to provide that care. Some caregivers said they don't need respite care. Some felt it was too expensive. And then there's the systems issues. There are no workers available when they need them. And so some caregivers noted that the times that workers were available were not the times when they needed care, or the amount of care, amount of support, financial support or instrumental support that they could get for using a worker to come in and provide respite care wasn't enough time. If they can only get an hour of respite care, especially in rural areas, that's not enough time for them to travel to a support group, to shopping malls, do the errands, or get the support that they need and then travel back. And so that makes it less useful, so they just don't use it. Issues with the quality of the care workers, not trusting anyone else to care, or this doesn't show up on this list, but we had a lot of responses around caregivers feeling like the inconsistency of care, the turnover in their care providers being a real issue for their ability to use that care. That falls into inconvenience. And interestingly, this was not something that we asked about, but in 4% of the responses from those caring for a child or a young adult and 7% of responses from those caring for an older adult, the caregivers spontaneously told us that they just don't know what respite care is. They don't know about it. They don't have any information about it. They didn't know it existed. And so that's an opportunity as well to share that information. We also ask caregivers about the impacts of caregiving, both positive and negative. And so I think this is really interesting because it shows that it really highlights that fact that caregivers get good things out of their caregiving role, even if they're experiencing adverse impacts from their caregiving role. So what we're seeing here is that many caregivers are expressing at least one of these. I think it was around 90% who identified at least one positive impact of caregiving: gaining empathy, becoming an advocate, bringing the family closer together, getting more support from family and friends. There were also a lot of reported negative impacts of caregiving. More than 2/3 said that they were tired or worn out all of the time. And they said that they experienced impacts on their social life, on their relationships, on their emotional health, their finances, their physical health, and their work. Here's a couple other key findings that I just want to highlight. These didn't come up in the data tables that I'm sharing here, but when I spoke with our stakeholders and with others on the Alliance, these were some pieces that bubbled up as being really important. So we asked caregivers where they get their information from. And the top response for caregivers of adults was doctors or healthcare providers. Now, I'm trained in population health sciences. That's my background. And so I wasn't surprised by that at all. That's where caregivers get information. But my community colleagues were very surprised by that. They hadn't considered that working with doctors and healthcare providers can help get this information and help with systems navigation for these caregivers. So this was a key finding for them and something they really felt was important to consider. When we looked at the top response for caregivers of children and young adults, it was other families in similar situations. So they got a lot of their information from the families that they interact with, either through their child's school or through their child's clinic or in support groups that they're a part of, other places where they meet families who have similar situations. And then for both groups, internet and social media was the second highest endorsed category. 37% of caregivers of adults and 48% of caregivers of children. And so we're seeing that people are turning to social media and the internet in order to gather information, which is not surprising. We know that people use the internet to look up information. The other piece that I find particularly interesting is that when caregivers asked about resources, most of the time they were asking about resources for their care recipient. 3 in 4 reported that they never asked about help for themselves as a caregiver. And that highlights a key issue for me. I think caregivers don't know that they deserve help and that help is available for them above and beyond what they might be getting in order to support their care recipient. So things that are targeted to the care recipient are a separate category, and there are things that caregivers can get access to themselves that can be very helpful. And this even includes things like educational opportunities, powerful tools for caregivers. Many, many caregivers said that they had never heard of those programs, or that they would like more information about those programs, didn't know enough. And so that highlights a key gap where we have the opportunity to share more information with families about these key resources that they can have access to. So now I'll switch gears and we'll compare some of what we found here with what we found in the provider reports. So the first piece I want to share is just give you an overview of what I'm talking about when I'm talking about these provider reports. These were collected in 2018, and it was a survey of professionals who support individuals with disabilities and their families. So these are people from agencies or support services in communities that are providing this work. The questions were broadly similar to those asked of caregivers themselves. We intentionally had overlap between the questions to whatever extent it was reasonable based on the audience. And in total, we had 216 professionals respond to this throughout the state of Wisconsin. And so here's some key highlights of what we saw when we compared the caregiver survey results with the provider survey results. The first similar question that we wanted to address was, do caregivers follow up on the resources? So when caregivers call and ask about resources and the providers tell them about resources, do caregivers follow up? So caregivers said that they sometimes or frequently followed up on those services. It was nearly the entire sample that said sometimes or frequently. Providers reported something very similar. Sometimes or frequently, caregivers were following up on the resources that they provided. But nearly 20%, nearly 1 in 5 of the providers said that they were unsure if caregivers were following up on the resources that they asked about. And so this highlights an opportunity because providers, or in some centralized way, systems can potentially follow up to find out whether or not caregivers followed up, and if they didn't, figure out what it is that they still need in order to get them the help that is going to be useful for them. What about when caregivers called? How often did they ask about services that aren't available? And so this might be services that aren't available from that particular provider or more broadly in the community. Caregivers said that sometimes or more often they were told that services were not available 78% of the time. So 78% of the caregivers who responded said that the services they asked about weren't available, sometimes or frequently. Providers said the same thing. A lot of the time, caregivers asked about services that weren't available. And so that really quantifies something that is a known issue that I imagine is frustrating for both caregivers and providers. When the caregivers are able to reach out and make contact and ask about a service, it must be extremely frustrating to know that that service isn't available. And for providers, I imagine that the same issue comes into play. Very frustrating to have caregivers asking, reaching out to them, and being told that the service they want isn't actually available. What about a good match between information and resources? Is there a good match between information and resources? Providers said yes, sometimes, and most of the time or always. So the vast majority are saying yes. Caregivers, on the other hand, when we asked them similar questions, 3 and 4 reported that agencies don't have a service they asked about. That was what we just saw on the last screen. And when asked why they didn't follow through on a recommended service, a quarter said that it didn't meet their needs. And so that shows that maybe there's not as good of a match between information and resources as the providers think, because a lot of the time, caregivers are asking about services that aren't available and are saying that services didn't necessarily meet their needs. So providers in particular may need more information about the instances where there's not a fit so that they can respond. When caregivers don't follow through, why? So when we asked caregivers about this, you saw this already, caregivers said that resources were not available. Nearly a third said that, whereas in the provider survey, only 16% noted that as a reason. Caregivers felt that they had difficulty navigating the system and they weren't eligible or didn't qualify. Those were the top reasons that caregivers highlighted. Providers, on the other hand, highlighted issues around caregivers feeling overwhelmed and around financial constraints for caregivers. And so what's interesting to me about this is that when caregivers are asked why don't they follow through, they're highlighting systems issues. They're highlighting resource availability. They're highlighting navigation issues. They're highlighting having trouble getting information over the phone or on the web. Whereas providers are pointing to caregiver issues, caregivers feeling overwhelmed, caregivers not knowing where to start or not knowing what they need, and then the financial constraints that come along with these resources. So that again highlights a disconnect that might tell us that there's issues on both sides. And with caregivers, they did also mention that they feel overwhelmed or that they don't know where to start. That's true too. It's not an either or, it's a both and. But the way that the responses stacked up in terms of the proportion who reported, endorsed each one, shows that for caregivers, those systems issues are much more important than what providers are potentially recognizing. What's interesting for providers is that nearly a third said that they don't know why caregivers aren't following up. And so that's a knowledge gap. And so that's an opportunity to share this information with providers so that they are able to better understand the challenges that caregivers are facing in the context of navigating systems and contacting them. We also asked about coordination of services. So for providers, 61% felt that they were knowledgeable about other resources available in the community. That's great. We want them to be knowledgeable about what else is available so that they can help caregivers. When they call and ask for a service that one provider doesn't have, they can then direct them to a different service to hopefully get them the help that they need. Caregivers, on the other hand, reported that they weren't always being referred to other services. In fact, 21% said that they were never referred to other services when something they asked for wasn't available. And some caregivers in particular spontaneously talked about the lack of coordination and centralization that they experienced and noted that as a key challenge and a source of frustration. So they felt like there wasn't that coordination, there wasn't that warm handoff from one provider to another in order to get the care that they needed. And they felt like they were either getting the runaround or having to jump over many, many hurdles in order to get support that they need and deserve. And then the last piece I'll highlight in this comparison is the biggest challenges. Providers said that caregivers' biggest challenges were that they don't ask for help, don't know that they need help, aren't aware of where to access information, or that whatever help they need isn't available or is underfunded. So again, this is highlighting that providers feel like caregivers are underinformed or are not bringing to the table an effort to ask for help as the key reasons, the key challenges that caregivers are facing in getting access to these services. Caregivers also highlight some similar things, right? They're unsure of what help they need or they don't know where to get information, but then they also highlight as key issues those systems pieces once again. There's no workers available, organizations don't offer what they need, or they can't get good information. And so this again highlights that disconnect where it's possible that providers need more information about what caregivers see as the challenges so that we can help everyone get more information. I absolutely agree that caregivers need more information about how to ask for help, understanding they need help, where to get information. That's absolutely true, and the providers highlighted that in a key way. But I think we also need to address the fact that maybe some of the supports that are currently available aren't lining up with what caregivers need, and they need additional help and assistance in accessing the things that are going to be most helpful for them. Okay, so what? What are the implications here? Well, so the first one is something, again, that my colleagues in the Alliance felt was really important, which is to reach caregivers where they are and where they go for information. And so in this case, the big aha for them was that medical system. And when I talk about that, I often talk about non-medical referrals being something that clinics can work in. This is usually a very systematic approach to helping families connect with the social determinants of health supports that they need. Things like housing support, things like food insecurity, things like getting enough exercise. Those are non-medical referrals, and there is a systematic way that clinics can screen for needs and connect individuals to the community level factors, the community level supports and services that are going to help them. I also talk a lot about the medical system embracing family caregiving better. And so understanding when they see their patient, who the family caregiver is, what role they have, the importance that that family caregiver has in supporting the health of the patient. But then also, especially in primary care, understanding that their patient, regardless of their age, might be a caregiver, and the impacts that that has on that individual's health and the way that that context influences the care that they need. So that's two things that I think we can incorporate when we're thinking about the medical system in order to better reach caregivers. That also touches on an issue of improving coordination, both within and across systems. So making the connections better between the medical system, the social support system, and the public health system. How do we make that happen where service providers know what's available? How can we centralize that better so that we are getting people the information that they need across systems without having them call 15 different places in order to get that information? Which ties into the third thing, providing them help with systems navigation. There's a range here. We know from some research that one of the key issues that caregivers face in getting support is that they don't recognize themselves as caregivers, and they don't necessarily recognize that support is available. So we want to help them with that. But then it goes from there to understanding what services are available, understanding that there are services and resources available, including respite care. I mentioned before that up to 7% of our respondents said that they didn't know what respite care was. And that's just one example of a support service. So we're seeing that people don't necessarily know what's available. And if they don't know what's available, they can't get access to it. Understanding the way that eligibility works and helping caregivers figure out what they might be eligible for, helping them apply, and making sure it's worth their while to do so. And so there's sort of this cascade, there's sort of this step-by-step process that we can help caregivers with so that they get the right services at the right time in order to support them. And of course, that ties into the last piece. We're reaching the right caregivers at the right time. And so to some degree, that is figuring out how we do the best needs assessments. How do we do that systematically? And how do we understand which caregivers are at the highest risk for adverse outcomes and get them the right help at the right time? And then it's also a systems issue of having adequate funding and paying our formal care workers enough so that they can stay in the workforce and can continue providing consistent care to families who need it. So these are several issues, several opportunities that we can act on in order to improve outcomes for caregivers. And what I think is interesting about these data and this information is that whatever the individual who's hearing it, whatever you all in the audience, there's probably something that I mentioned that you picked up on as being really important in your own context. These are the ones that stand out for me, but I welcome everyone else to pull their own implications from this and their own interpretations and use it to inform the way that they think about their own role. And of course, this is Wisconsin caregivers. It's not meant to be representative, but I think that there's a lot that can also be gleaned from this in order to understand what's going on for caregivers and in order to make changes in our systems and in our education approaches that can help family caregivers. So within an extension context, I think Extension has a role in policy systems and environment change. Extension also has a role in education. And some of this is educating providers, some of this is educating medical professionals, and a lot of this is educating families to help them understand the way that systems can support them in their family caregiving role. So for those of you who may be interested in a deeper dive into solutions that stem from this is a reading list of 4 articles and reports that I think are really helpful. They talk about ways that we can help caregivers and especially some innovative solutions that other areas are using that might be helpful in pushing this work forward and in helping caregivers access the services that they need and get the support that they need. So a big thank you to the systems navigation work group members who were instrumental in putting this survey together and getting it out there and getting this needs assessments together. They are also actively working on disseminating this information and helping make changes with this information. So we are continuing this work and pushing it forward. Before we get to questions, I do want to make a note that you should all save the date for the next NCRAN webinar. The next one is on addressing the financial security of caregivers. It's from the wonderful Suzanne over in Iowa. And so I highly recommend on May 1st that you tune in for that. That one will be pre-recorded, I believe, so do take a look at that.